So athospermia is a condition in which there is no sperm measurable in men's ejaculate, and approximately 1% of the men have azoospermia, and specifically 10% around of infertile men are diagnosed as athospermic. So this pathology doesn't have noticeable symptoms for the men, so it's important to perform a seminogram for the diagnosis. Moreover, for a more accurate diagnosis, it's important to analyze your hormones as FSH, testosterone, and molecules as fructose. There are two main types of athospermia depending on the cause: obstructive asospermia and non-obstructive asospermia or secretory asospermia. So I will start explaining a little bit about the obstructive azoospermia. In this type of azoospermia, we see that there is a blockage or a lack of connection in the reproductive tract between the testicles and the urethra. That means that the man is producing sperm, but that sperm is not able to be ejaculated because it is getting blocked from the exit. Therefore, there is no measurable sperm in the semen. The common causes are the absence of different conductors since birth or due to a surgery, and inflammation or trauma in testicles, epididymis, prostate, or different conducts. The surgery is the only treatment that can be effective in those patients, and it's based on unblocking the duct in order to allow the passage of the sperm. However, in the cases that it is not possible or it doesn't work, the testicular biopsy or the microsurgical epididymal sperm aspiration is another option to get viable sperm and then perform an ICSI. However, in other cases, it's very difficult to get sperm from the biopsy, and it is necessary in those cases to use a donor sample. On the other hand, non-obstructive azoospermia, or also known as secretory azoospermia, is the most common and severe type of azoospermia that we find in the 70% of the cases of azoospermia. In those patients, we don't find sperm in the ejaculate, but in that case, it is caused due to problems in the production of the sperm during the spermatogenesis. This pathology can be congenic since birth or acquired due to an illness, toxic drugs during a treatment, or the cancer treatment that can affect the production of sperm. It is a serious pathology, even though it can be solved in some cases after treatment. So we can say that in some cases, the secretory athospermia may be reversible and can allow pregnancy without the need of IVF technique. It's very important to determine which type of azoospermia is present in the patient in order to know which is the best option for the man in that case.